The characteristics of autism spectrum disorders can become manageable with the help of therapy. However, each child is different and requires a unique combination of therapies to properly fit their needs. I will briefly cover the 8 therapies recommended for children with autism that autismspeaks.org promotes. First, applied behavior analysis, or ABA, is based on the premise that appropriate behavior, including speech, academics, and life skills, can be taught using scientific principles. This method capitalizes on a technique first discovered by B.F. Skinner and later refined by Lovaas called positive reinforcement and can be used in school or the home. The hope is that good behaviors will be repeated enough times with the help of a reward that eventually the reward will no longer be needed and the behavior will become natural. This method can be used to teach eye contact, imitation, fine motor skills, self-help, academics, language, and conversation. Students start with learning small skills and gradually learn more complicated skills as each smaller one is mastered. Today, ABA is widely recognized as a safe and effective treatment for autism. It has been endorsed by a number of state and federal agencies, including the U.S. Surgeon General and the New York State Department of Health. Some who participated in early intensive ABA for 25 to 40 hours per week for at least 2 years acquired enough skills to participate in regular classrooms with little or no ongoing help. However, some still required more help. Everyone is different and will therefore respond differently to each therapy. Second, pivotal response therapy, or PRT, lies in 4 identified pivotal learning behaviors: motivation, responding to multiple cues, self-management, and self-initiations. This method builds on each learner's individual interests and their initiative. It has many benefits, but is particularly effective in helping to improve socialization skills, communication, play behavior, and overall language development. Previously called the natural language paradigm, pivotal response training was developed by Dr. Robert and Lynn Kogel at the University of California, Santa Barbara, and requires around 25 hours per week of child-centered therapy. Research has shown that the use of motivational techniques inside PRT's teaching framework can lead to 85 to 90% of children with autism who begin intervention before the age of 5 developing verbal communication as a primary mode of communication. Third, the Early Start Denver model, or ESDM, is a comprehensive behavioral early intervention approach for children with autism ages 12 to 48 months. This early intervention program integrates a relationship-focused developmental model with the well-validated teaching practices of ABA. Its core features include naturalistic ABA strategies, sensitive to normal developmental sequences, deep parental involvement, focus on interpersonal exchange and positive effect, shared engagement with joint activities, and language and communication taught inside a positive, effect-based relationship. A randomized clinical trial published in the journal Pediatrics showed that children who received ESDM therapy for 20 hours a week over a 2-year span showed greater improvement in cognitive and language abilities and adaptive behavior and fewer autism symptoms than did children referred to interventions commonly available in their communities. However, each child will respond differently to each therapy. Fourth, verbal behavior, or VB, is the latest style of ABA. Like ABA, the VB program will use errorless teaching methods, prompts that are later reduced, and discrete trial training based off of B.F. Skinner's work. This method is designed to motivate a child to learn language by developing a connection between a word and its value. It may be used as an extension of the communication section of an ABA program. This 30-hour per week therapy can help children improve their communication. Fifth, the DIR floor time model is a copyrighted, specific technique to both follow the child's natural emotional interests, or lead, and at the same time challenge the child toward greater and greater mastery of the social, emotional, and intellectual capacities. It was developed in the 1980s by Dr. Stanley Greenspan. The D in DIR stands for developmental. It is important to understand where the child is developmentally to better help him and meet him where he is. The I stands for individual differences to describe the unique, biologically based ways each child takes in, regulates, responds to, and comprehends sensations such as sound, touch, and the planning and sequencing of actions and ideas. The R stands for relationships with caregivers, educators, therapists, and peers. Floor time is both a specific technique in which, for 20 or more minutes at a time, a caregiver gets down on the floor to interact with the child, and a general philosophy that characterizes all daily interactions with the child. The goal of floor time is to help the child reach 6 developmental milestones that contribute to emotional and intellectual growth: self-regulation and interest in the world, intimacy or a special love for the world of human relations, two-way communication, complex communication, emotional ideas, and emotional thinking. In floor time, the therapist or parent engages the child at a level the child currently enjoys, enters the child's activity, and follows the child's lead. Sixth, the Relationship Developmental Intervention, or RDI, is a copyrighted, parent-based clinical treatment that seeks to correct the core social problems of autism, such as friendship skills, empathy, and the desire to share personal experiences with others. Developed by psychologist Stephen Gustein and his wife, Dr. Rochelle Sheely, this method tries to help children interact positively with other people, even without language. The 6 objectives of RDI are emotional referencing, the ability to use an emotional feedback system to learn from the subjective experience of others; social coordination, the ability to observe and continually regulate one's behavior in order to participate in spontaneous relationships involving collaboration and exchange of emotions; declarative language, using language in nonverbal communication to express curiosity, invite others to interact, share perceptions and feelings, and coordinate your actions with others; flexible thinking, the ability to rapidly adapt, change strategies, and alter plans based upon changing circumstances; relational information processing, the ability to obtain meaning based on the larger context, solving problems that have no right and wrong solutions; and foresight and hindsight, the ability to reflect on past experiences and anticipate potential future scenarios in a productive manner. A study found that 70% of the children in the 16-month case improved at least one category on the Autism Diagnostic Observation Schedule. Seventh, treatment and education of autistic and communication-related handicapped children, or TEACH, involves a classroom that is structured with separate, defined areas for each task, such as individual work, group activities, and play. It relies heavily on visual learning, a strength for many children with autism spectrum disorders. The children use schedules made up of pictures and/or words to order their day and to help them move smoothly between activities. Developed by Dr. Eric Skopler, this method is found primarily in classrooms and has too little research to have a conclusive numerical outcome. Eighth, the acronym CERTS focuses on social communication, the development of spontaneous, functional communication, emotional expression, and secure and trusting relationships with children and adults. Emotional regulation, the development of the ability to maintain a well-regulated emotional state to cope with everyday stress and to be most available for learning and interacting. Transactional support, the development and implementation of supports to help partners respond to the child's needs and interests, modify and adapt to the environment, and provide tools to enhance learning like picture communication, written schedules, and sensory supports. Found in a school setting, the CERTS model favors having children learn with and from children who provide good social and language models in inclusive settings as much as possible. This model can be used with children and older individuals across a range of developmental abilities, including nonverbal and verbal individuals. It is a lifespan model that can be used from initial diagnosis throughout the school years and beyond. It can be adapted to meet the unique demands of different social settings for younger and older individuals with ASD, including home, school, community, and ultimately vocational settings. In addition to these 8 therapies are 2 more important techniques often used to help children with autism: animals and music. The companionship of animals such as dogs, horses, and rats can help reduce any lonely feelings in children with autism, promoting a base of healthy character development within them, including personality traits such as being respectful, trusting, contributing, committed, self-confident, and responsible. Children with autism can also learn decision-making skills, problem-solving skills, and both language and social skills through interactions with animals. The blood pressure of autistic children will also usually be lowered when experiencing an animal treatment. Furthermore, symptoms such as insomnia and headache can be eased with this treatment. This relaxation will help the child open up and possibly speed treatment time. Music therapy involves clients in singing, listening, moving, playing instruments, and creative activities in a systematic, prescribed manner to influence change in targeted responses or behaviors and help clients meet individual goals and objectives. It is beneficial in multiple ways. People with diagnosis in the autism spectrum often show a heightened interest and response to music, making it an excellent therapeutic tool to work with them. Music is a very basic human response, spanning all degrees of ability and disability. Music therapists are able to meet clients at their own levels and allow them to grow from there. The malleability of music makes it a medium that can be adapted to meet the needs of each individual. Music is motivating and enjoyable. Music can promote relatedness, relaxation, learning, and self-expression. Music therapy addresses multiple developmental issues simultaneously, and music therapy can provide success-oriented opportunities for achievement and mastery. The structure and sensory input inherent in music help to establish response and role expectations, positive interactions, and organization. Remember, all children and adults are different and therefore require a different combination of therapies for greatest improvement. Consult your local speech therapist or developmental psychologist for more information and a complete diagnosis.